Introducing the FastSystem from Omni Tract Surgical, a step ahead in retractor system design. The following program will demonstrate the FastSystem frame assembly and positioning features, retractor blade attachments and blade versatility, system flexibility, a helpful hints review section, and care and maintenance recommendations. Begin by placing the sterile field clamp onto the table. Simply position the upper jaw of the clamp on the table rail and raise the post to a vertical position. Next, place downward pressure on the top knob to engage the threads and begin turning the knob clockwise until the clamp is secure. The wishbone assembly is a one-piece component. In addition to eliminating setup steps, the frame arms and swiveling securing clamp are under constant tension to control the flopping of the frame, making it easy to use. Next, attach the wishbone assembly to the sterile field's cam clamp. Be sure that the securing handle of the sterile field cam clamp is opposite the patient and the cam clamp handle is pointing down in the unlocked position. While supporting the cam clamp with one hand, insert the wishbone support arm into the clamp. With the sterile field's cam clamp still unlocked, position the wishbone so that the large securing clamp is approximately 4 to 5 inches superior or inferior to the edges of the wound and about 1 to 2 inches above the patient. Lock in the desired position by securing the sterile field cam clamp. The constant tension wishbone allows you to adjust the arms simply and precisely for various incision sizes, patient sizes, and positionings. Once the arms are in the desired position, simply push the securing clamp handle back to lock the arms. To attach a blade to the wishbone, simply attach a snap clamp to the frame. It is important to make sure that the snap clamp's cam handle is in the unlocked position. Partial locking of the handle will make attachment to the frame difficult. Next, hold the snap clamp on the inside of the wishbone in a vertical position so that the jaws are ready to receive the frame. Be sure the snap clamp's cam handle is in the unlocked position. With the frame arm and snap clamp between your thumb and forefinger, squeeze the clamp onto the frame. To remove, simply peel the clamp off the frame by grasping the upper half of the clamp and turning the clamp sideways. To ensure smooth usage of the snap clamp, practice applying and removing it from the frame. You can also apply the clamps easily over the narrow bend sections of the wishbone frame, or you can slide them over the distal ends of the frame arms. Your FastSystem retractor offers a variety of blade patterns and blade shaft configurations. When attaching blades to your system, it is crucial that you introduce the retractor shaft into the snap clamp prior to placing the blade into the wound. The blade snap clamp combination allows you unlimited adjustability. The swivel retractor shaft allows blades to self-align on tissue, giving you the freedom to position the blade shafts out of the way. Additional snap clamps and blades can be placed onto the frame as needed throughout the procedure without removing or repositioning retractors. Unlike other popular, more expensive ring retractors, you can place 2 retractors in the same plane. With overall setup completed in less than 60 seconds, exposure is simple with the Omni Tract FastSystem. The system's flexibility will provide you with excellent exposure for abdominal aortic aneurysms, radical retropubic prostatectomies, general abdominal procedures, and abdominal hysterectomies. On most procedures, offset the sterile field clamp approximately 12 inches away from the wound. Surgeon preference dictates the side of the table the clamp is attached to and whether or not it's placed toward the head or foot of the table. The support arm length allows you to position the wishbone away from the tall sterile field post to avoid potential interference. Also, you can position over the largest patients with ease. Once the support arm has been secured, wishbone frame arms can be positioned in a low profile. Placement of the wishbone arms too close to the incision limits the distance the retractor blade shaft can move within the snap clamp. It is important to be sure that you have adequate spacing of the frame arms away from the incision so that you can retract sufficiently. Placing the frame arms too far above the patient will cause all blades to toe in, and retraction direction will be limited to lifting the wound margins rather than retracting away from the midline. You will also find that working over and down through the frame will impede your access to structures deep in the wound. The low-profile positioning capability of the FastSystem provides you with unobstructed access to the operative field, and the exposure is far superior to any other retractor available. To prepare the system for sterilization, begin by opening up the one-piece sterile field clamp. Simply rotate the knob counterclockwise to disengage the threads. Be sure the cam clamp is in the loosened position. Open the large securing clamp on the wishbone assembly as well as the one-piece snap clamps. Ultrasonic cleaning is recommended. Power washing or hand scrubbing is also acceptable. All components should be lubricated frequently with an accepted instrument lubricant. Refer to the user's manual provided with your system for recommendations. The preceding demonstrations are only suggestions. Use of the system for any surgical application is solely at the discretion of the user. Patient contact with any portion of the system should be adequately padded.